Hey guys, how are you? This is Dr. Stephanie Stroud from Cornerstone Animal Hospital. I'm so excited to get on with you guys today. So right now I am in Knoxville, Tennessee, and I'm actually doing some continuing education right now. I'm actually at a rehabilitation conference. And so this is super exciting because rehabilitation in animals is not very common, and it's just going to completely change the field of veterinary medicine, and it means a complete change in some of the healthcare for your fur babies. So what is rehabilitation? Rehabilitation is anything that we're using to try to help an animal improve its quality of life when it comes to fitness, when it comes to painful chronic conditions such as arthritis. Maybe your dog has had a back issue, little dachshunds, and they have some spinal or neurologic issues. Rehabilitation can be used in that to help improve their function, helping them return back to a normal life, or even help them just return to help them live a good quality life. It can be involved in weight loss and conditioning. So there's so many different things we can use rehabilitation for. And so I am actually in the process of getting certified. I will be certified very soon as a canine rehabilitation practitioner, which I will actually, it's the only one in Missouri certified through the University of Tennessee program. So it's super exciting to be able to do that and to bring that to you guys. And so, if you have a furry family member that you feel like is arthritic, or that you're really struggling to get the weight off of, or maybe you do agility training, you want to help them train better, we're soon at Cornerstone Animal Hospital going to be able to offer you more help with that, designing exercise programs and that type of thing. But I did just want, I'm excited to be here, but I wanted to give you just a few tips on things you may be able to do right now when it comes to rehabilitation. And so one of the most common things I see is older geriatric arthritic patients. And so I always get asked the question about exercising them because of course it's hard for them to get up. And so best type of exercises this time of year for arthritic patients usually involve swimming. And I would recommend, it depends on the patient, and you should definitely consult your veterinarian prior to doing this, but that could involve multiple different things. You can do swimming for a few minutes, sometimes even doing something simple as leash walking. And what I will tell you guys is that frequency is always better than length. And so what that means, it is much better to typically walk your dog that's a little bit older and maybe has some arthritic problems 4 times a day for 5 to 10 minutes rather than 1 time a day for an hour, or 2 times a day for 30 minutes, because they are going to get tired sooner, just as we get tired sooner, okay? So that is kind of just some general tips. This time of year, what's really hot, swimming is an excellent way to exercise for your pets. You do want to make sure that they are vaccinated against things they can contract in the water, so definitely talk to your veterinarian about that. And I always recommend talking to your veterinarian before you start any exercise program. So if you have not been regular exercising your pet, you definitely need to consult with them to make sure that they are at an appropriate fitness level for the different things you're going to try, just like we are recommended before we go to start a intense workout program that we talk to our doctor. So that's kind of just some simple tips and some exciting news to bring you guys. So I hope you have a great rest of the Monday. I'm looking forward to getting back with you guys and seeing all you guys again once I get back from the conference. But for now, I'm going to learn as much as I can. So as always, be sure to drop in and say hello, comment, wave, give me a thumbs up, let me know that you watched this. If you have any questions about what rehabilitation is, be sure to drop those, or anything like that. I'd be happy to share more with you. All right, we'll chat with you later. Bye.